is Jeremy Edwards with GAINSWave, and I'm here with Dr. James Fontaine, a GAINSWave provider in California. Dr. Fontaine, tell us about your specialty and your practice, please.
Well, initially I did my training in physical medicine and rehabilitation, and I've been board certified in that field for about 25 years. The initial part of my practice I spent doing musculoskeletal medicine, but trying to keep a focus on the whole person, which is sort of the backbone of PM&R. And then after years and years of doing that, I decided I wanted to change things up a bit. So I wanted to do more healthcare as opposed to more reactive disease care. So I did some retraining. I did extensive retraining. I trained in lipidology, preventive medicine, bioidentical hormones, regenerative medicines, things like that. And ultimately, I was able to open a optimal aging practice where we really focus on aging gracefully and focus on just aging well and being functional and living a great life as you get older. So we do that through bioidentical hormones, regenerative medicine, nutrition, exercise, and other lifestyle factors. And I found that it's really been a much more rewarding way to practice medicine. And of course, as we're dealing with hormones and all that, of course, we do a lot of men's health. And as part of the men's health, if you see any significant number of men, you're going to come across erectile dysfunction. And really, when it comes to treating the whole person thing, erectile dysfunction is such an important part of a man's life. It's really important that men can be, intimate with their partners. And I've even found that, especially with the younger men, if they have erectile dysfunction, it can affect their confidence, their sense of well-being. That can affect the way they play sports or interact at work, interact with their lover or whatnot. So we've really found that treating erectile dysfunction has really been a very rewarding part of our practice. So something that we added and really that's sort of how I came about GAINSWave, is because I wanted to enhance erectile function as part of treating the whole person as they age healthy and they want to remain active.
Thank you. And how did you hear about GAINSWave originally, and how long has it been part of your practice?
So we've been doing it for about 2 years. And initially, I heard about it from another colleague who has a similar practice, who does a lot of healthy aging or optimal aging in his practice as well.
And what features of the GAINSWave program do you find most valuable? What member benefits are most important to you and your team?
So what I like about GAINSWave is I think it's really a complete package for implementing a new procedure into your practice. There's a marketing component, there's a training component, there's an ongoing education component, and there's, for example, webinars, there's a physician or provider chat room, so you can do questions and answers with other providers. So really, I think it's an easy way to implement a new procedure. But really what I think I like the most about the GAINSWave platform is the education for the patients. If I get a referral from the provider portal, my patients are really well educated. They have a good sense of, hey, what's going on with erectile dysfunction? What is the cause? What's some of the vascular causes? And they also know about the procedures. So they understand about the shockwave therapy, the fact that it's been in existence for over 20 years. There's lots of evidence-based medicine that backs up the procedure, and it has an excellent safety and efficacy. So the patients, by the time they come to me, they're almost already sold on the procedure. So I think that's probably my favorite part about GAINSWave, is how well they educate the patients.
We do spend a lot of time and effort and resources in raising that public awareness and educating the patients before they're pushed to our member providers, of course, before they're sent to you, which I guess, as you mentioned, makes your job a little more easy. You don't have to explain what GAINSWave is. You don't have to explain the procedure, the process. On the subject of GAINSWave patients, how have they responded to the GAINSWave treatment in terms of good outcomes?
I've been very, very pleased with the way our patients do. There's hardly ever a patient that does not have a substantial improvement in their erectile function. So it's really about function. We do the SHIM score, which is a score of erectile function, the before and after, and they are always improving. I mean, not every single patient, but the vast majority of patients do improve. And we typically combine our GAINSWave with the P-shot, which, as you know, is a platelet-rich plasma shot into the erectile tissue. And I think the two of them together are really beneficial because they're very complementary, because I think that both platelet-rich plasma and GAINSWave, they're really both regenerative procedures. They really go at the root cause of erectile function and try to optimize the erectile tissue to bring about better erectile function.
Yeah, there does seem to be a great synergy between GAINSWave and PRP, platelet-rich plasma injections. Is there a specific GAINSWave patient story that stands out to you?
So I recently saw a patient who is in his 70s, and he had moderate erectile dysfunction based on his shim score. He underwent a P shot as well as 6 GAINSWave treatments. We did the P shot after either the second or third GAINSWave, I'm not sure. And then I saw him about 6 weeks post P shot, and his shim score had improved to 25 out of 25. I mean, so you can't do any better than that. And the guy was ecstatic. He was having a good sex life, and he was very pleased with his improved performance. But the other kind of major person I see over and over again is someone who, I think I said major procedure. Let me go back and say, the other thing that I see very often, the other type of patient I see is one who, for lack of better words, is just trying to get back into the game. It could be someone who's recently divorced or otherwise left a long-term relationship. And commonly I actually see, a man who's a widower who says, look, I want to be intimate again. I want to date women, and I want to see if it leads to a sexual encounter, I'll be able to perform. And they're a little bit apprehensive. And so they just want to feel better about it. And so I see a lot of patients who come to me who just want to kind of make sure that they're going to be confident and feel a little better about themselves from a sexual standpoint with regards to erectile dysfunction. I even had a few patients who told me that their kids sent them in. They say, look, Dad, Mom's been passed away for years now, and we want you to be happy. We want you to be with another woman. And I don't know if they meant sexually or not, but maybe they meant just a relationship. But Dad took it to interpret, hey, let's have some fun. So we see all sorts of patients who all kind of do well.
That's amazing. Thank you for those insights. And then finally, what would you tell a fellow doctor who's considering adding GAINSWave to their practice?
I think I would tell them that if GAINSWave is complementary to something you already do. So in other words, if you have a practice where you're doing men's health, whether it's family practice, urology, regenerative medicine, whatever it is, something that you already have a captive audience that may have erectile dysfunction, it's really an easy thing to add. The cost of entry really is not that high. The equipment is not all that expensive. And out of all the different things I've added to my practice, I think GAINSWave has been one of the easier ones as far as a pretty comprehensive platform. Like I mentioned, it has marketing and training and, staff support, all sorts of different things that really make it pretty easy. So I think it's kind of a no-brainer.